I am delighted to introduce at this time Dr. Lourdes Benes. Dr. Lourdes Benes is a distinguished neurologist. Look at that. You are loved. A distinguished neurologist specializing in movement, cognitive and memory disorders. Her expertise in cognitive health and Parkinson's is unmatched. Today, she will delve into unlock your mind, strategies for enhanced cognitive health and Parkinson's. Please give a warm welcome to Dr. Benes.
Gracias. Buenos días. Everybody knows Spanish here. I know. Most of you are my patients. Thank you so much for being here. Again, it's a pleasure to have you all. Very important people, but the most important people in this room are all of you. Thank you again. Coming here to learn and get more information is going to be very powerful for you. So please pay attention. I'm gonna be talking a little bit about memory, but I think the tips that I'm gonna give are good for everybody. They're not specific for Parkinson's. They're for everyone in this room. Now, in Parkinson's, the things happen a little bit faster compared to other people your age, right? So it's gonna apply to Parkinson's patients also. The topic is pretty broad, and we can go from normal and what is normal for age to dementia. But because it is so broad and I have not that many, but the time is limited, I'm just going to go ahead and focus on just like the early stages or mild changes where we can actually get our good diagnosis and start working and doing a few changes in our life to try to live longer independently. And I think that's all what we want, right? Everybody in this room most likely knows what means, you know, when you need extra help or when you need to go to assisted living facilities and those kinds of placement. So we want to live independent as much as possible. And that's what I would like to give you some tips to see if we can accomplish that. Before I continue, I want to say thank you also to Dr. Rodriguez, Jennifer, and Eduardo. Eduardo, thank you so much for making this happen. I think everybody knows Eduardo by now, right? You have a lucky wife. Anyways, so let's start then here. Okay, and now most of you have seen this slide before, and I keep putting it in my presentations just because there's a lot more that happens behind the scenes, right? When you see somebody with Parkinson's, basically see somebody that usually shakes, that is slow, that have walking problems, balance problems, right? But behind the scenes, look at how many other things are happening, right? And most of them we are not even aware unless you guys pick up and let us know as physicians, okay? Now, out of everything that I wrote over there, cognitive changes is the one that I'm gonna be talking today. But that one is a good slide to take a picture, and then when you get home, try to see which of those things are happening to you so you can have a discussion with your doctor. Cognitive changes in Parkinson's are different from the ones in Alzheimer's, right? That's the first question that a lot of the patients ask me when they get to the clinic. Doctor, is this normal for my age? Is this Alzheimer's or is this Parkinson's related? The difference between the changes in cognition between Alzheimer's and Parkinson's is that mainly the changes that you're gonna see are due to problems with executive function. So what does this mean? Executive function is the ability to plan ahead of time. So there is difficulty planning ahead of time. It's not that you're not able, it's that it just takes longer. So you're able to learn new things, you're able to actually store the information in your brain, you just don't remember where you store the information, and that's the problem. So then it's like kind of a disorganized situation that you put it in the wrong drawer, and then you want to say something, and you know it's there, but what is it? Where do I get it? And that's when you start like kind of thinking where you put it, and until you're prompted, you can come up with whatever you want to, you know, the train of thoughts that you were having. So the ability of making decision, planning, and strategy become affected earlier or sooner in Parkinson's, and that's different from Alzheimer's. Alzheimer's, learning new information becomes a problem. Now, multitasking, we all have difficulty multitasking. It doesn't matter if you have Parkinson's or not. If you multitask, the chances of making a mistake is gonna be high. So multitasking actually becomes a little bit more problematic in Parkinson's. So obviously, as I'm saying this, you must be thinking, what can I do then to help yourself to try to improve these situations. So obviously, try to stay focused on one thing at a time. Finish one job before you start the second. Write things down and plan ahead of time. So wake up earlier, sit down. After you take the medications, right? That's usually when the brain is working better. Then start to plan the rest of the day so everything can run more smoothly. Problem solving, organization. You don't need to make a decision right away. So when people are talking to you, it's going to take some time for that to sink in your brain. And instead of just shutting out an answer immediately, you can just kind of say, let me think about it, take the information with you during the night or the next day during the morning, think about it, and then you can actually get back with a solution, right? So being organized, the information is there. You just have to kind of sit down and see where you store that. Getting panic when the word doesn't come out or when the information that you have in your brain doesn't come out the way that you would like will actually make everything worse. So do not get anxious if that happens. You just can relax, breathe, and if it doesn't come back, that's fine. I mean, nothing bad is going to happen out of that, right? But getting anxious because of this is just going to make everything worse, okay? So there is another problem that happened in Parkinson's, and is basically the slowness in the thinking. So the same way that the body becomes slow, as due to the same pathology, right? Like the decrease in the dopamine in the system, the thinking process becomes slower as well. So tips for that is, as I was saying, plan ahead of time. You know that it's gonna take you longer. Take the medications on time. Dr. Okum was mentioning how important it is to take the medications on time, and this is one of the diseases that if you don't take it on time, you're gonna feel those off periods, right? Then request written information, and that's very good when you go to the doctor's appointment or any kind of situation that you have to make decisions. So because of this thinking speed being affected, ask them to give you the information written so you can go home, read it, and then you can come up with a plan, right? And take your time and do not rush with your answers. That's what I was telling you a little while ago. It is okay to say, can you say that again? I couldn't hear what you say. Can you repeat that? It is okay to do that. Take your time and do not rush. Now, there is a common problem that we have in Parkinson's that is related as well as the disease progress with the memory as well. And that's the tip of the tongue, right? And a lot of patients get frustrated with that and get anxious with that. So what can you do if that is happening to you? Now, if you know what word you want to say, but the word doesn't come back, just try to go over the alphabet. You know that it was something that started with an A, so go and try to think, what was it? Or have somebody help you as well, like having somebody kind of telling you, yeah, it was, we were in a meeting with, and you don't remember the name, but you have somebody that will say, yeah, she was the tall girl that is from Puerto Rico that starts with an L, and then you're able to recall. So all those tips, like having somebody helping you and cueing you, you should be able to make it, okay? Now, to improve everything memory-wise that we're saying, there are different things that can be done besides what I was just saying about a few tricks. But the importance of physical activity is the key. So now, more than medications, the medications do not work as well if you don't exercise. If the best pill for Parkinson's is exercise, literally. Working out, doing cognitive and physical activity is very important, and it should be done on a daily basis. Now you have the opportunity to get physical and occupational therapy, and here in our vendors, we have Mary from Say Yes as well. That's one of the referrals that we made to her is for this, for physical and occupational therapy. They do speech therapy and cognitive therapy as well. Cardio and strength training, both are very important for memory as well. So at least like 20 minutes of cardio activity and strength training, that it could be with bands, it could be with free weights, is important. Gait and balance. So balance and falls is one of the most common reasons of morbidity in Parkinson's. So getting that gait and balance training that can be provided through therapy is pretty important as well. Fine motor movements can be provided by occupational therapy, so getting them involved to help you with that is also, everybody in this room should be getting that. And then we have different programs that are trying to mix the motor skills and the cardio activity that you need with the brain or cognitive activity that is recommended. For example, we're creating this program that is called NeuroFit along with Jiu-Jitsu to try to then target both things, to do your cognitive exercise and your cardio strength and balance in one program. So here we actually have Ricardo Liborio and Graham, and yeah, you can come in. So he's actually going to talk to you a little bit about how Jiu-Jitsu can help, not only Parkinson's, can help everybody in the room.
Buenos dias. Good morning, guys. My name is Ricardo Liborio. I've been involved in martial arts since 4 years old. Whether like it or not, everybody here, it seems like you're in a fight. You can't take away from that. You know, I've been training professional fighters since I was actually training too. And nowadays, I dedicate my time teaching little kids from 3 years old. But I know one thing, there's so much synergy and parallel with what we're doing. Number one is recognizing that, you know, the tough times are coming and you should be prepared for things like that. Recognition is what we call, you know, embrace the cactus. Many times it makes you relief. What do we try to do with these collaborations, you know, with Dr. Luli, is a really combination of a learning certain perspective that you probably never saw and never, you never imagined before. But time is now. We're involved in training people to realize that martial arts is there, and you like it or not, you know, discipline is part of this game. Learning how to win, but learning how to lose, like you just said right now, is part of the game. The frustration that builds up, you know, understanding that sometimes you're not in control, but the discipline helps everything. This thing about coming back in the next day, doesn't matter how you feel, is essential. It is a really great value that you learn into martial arts. But beyond anything else, it's about people. When you go to a fight, you're one of the best coaches and you're one of the best people around you, is your community. That's what it is. It's always about the community. And I say this when we create this collaboration with NeuroFit, nobody better than her, you know, that we know that. You know, is a fantastic human being, you know. It is the best coach, the best doctors that's out there. So we're very honored. We really appreciate you a lot, you know. You and your family, the Duarte, if you're here right now, you know, and the dads. We know how important to try to give you support, and I hope our collaboration add on and support you even more. So thank you very much. It's an honor to be here. Thank you.
Thank you, Ricardo. Thank you again. So getting back to this, and again, thank you to you and obviously martial arts. Going back to the presentation, the message that I'm trying to tell you is that in order for memory right? To be better, in order to be independent. Not only we have to do these cognitive exercises, but also physical activity, okay? And then this physical activity, I was just telling you how you can get it through physical therapy, occupational, and these programs that we were talking about. Now, in terms of cognitive exercises, a lot of people would say or would ask us, what do you mean when you say cognitive exercise? So there's different areas of the brain that needs to be exercised daily. Most common situation that I see in the clinic is that after the patients retire, that's when usually the memories start to become a problem. And that's because literally the brain retires itself as well, right? So every day doing some kind of activity, and it doesn't have to be everything that I'm gonna say, but at least 45 minutes of either reading, and when you read, writing, and when you write, actually a summary and your impression, because I can be reading Chinese and I don't know what I'm reading. So you need to make sure that you're understanding what you're saying, right? Word finds, crosswords are some of the things that you could be doing. Also, there are other areas of the brain that needs to be exercises and include the area that deals with music, so playing an instrument or learning a song or dancing, that would count for that. Art is very important. There's a lot of data, and I think Albert is around here as well from a VA that is big on this art therapy, right? So yes, arts would be painting, drawing. It could be any kind of art that involve your hands. So for example, ceramics would actually count for that as well. So every day, you don't have to be doing everything, but at least one of them during 45 minutes combined with the exercises that I mentioned before. That is going to be your best prevention or the best bet that you can do to try to remain as independent as possible. And those things you're not going to get with any medications. Actually, we see patients that are on medication and doing these kinds of stuff, and other patients that are on medication and watching TV, and you see the difference is significant, right? So brain health is how to prevent or how to avoid these memory concerns to get worse over time. We cannot do anything against aging, but we can do something regarding these matters that I wrote here. So exercise, we already discussed that, and the mental stimulation as well. Smoking and alcohol, everybody knows what smoking and alcohol can do to your brain and to your body. So that's something that obviously you guys are doing or are avoiding already. Over there in smoking and alcohol, I would add as well the exposure to toxins. Dr. Okum spoke a little bit about exposure to toxins. We have a lot of veterans here, and more than Camp Lejeune is it could be like veterans that went to Vietnam that were exposed to Agent Orange. There's Gulf War illness as well. So all these kinds of exposures can definitely affect the memory and can affect, and we know that there is evidence also that it may be linked to Parkinson's as well. Diet and hydration, and we all know about the Mediterranean diet, the Means diet, right? And how good it is for our brain and for our system. When we're talking about diet in Parkinson's, remember, as Dr. Okum mentioned, that there's a small percentage of the patients that actually the protein can affect the absorption of the medicine. So you have to kind of sort that out. When are you going to take the medicine based on the protein intake, which is very important. You still have to do the protein. It's just a matter of, rearranging the schedule to see at what time you're going to be doing it. Hydration. Parkinson's actually can affect a system that can cause dizziness when you stand up. And if that happens, you can fall, and some people collapse. So making sure that you're well hydrated, and we use as a magic number 64 ounces, but that changes from patient to patient depending on their other medical conditions. So if you have somebody with a heart issue that have water restriction, could be an exception. On the other side, you may have somebody like you're gonna hear, like Mr. Murray, that is very active, right? And you're gonna see him with at 81, he's actually doing waterboarding. So somebody like that have to drink even more water because he's going to be dehydrated easy, right? Stress and depression. Both of them are very prevalent in Parkinson's, and actually they can cause memory problems. and there is something called pseudo-depression, pseudo-dementia, and it is this type of patients that look demented or look like they have a lot of memory problems, and it's actually an underlying depression not being treated. So addressing stress and depression, very important for brain health. We spoke about the blood pressure and how that can lower in Parkinson's, and that's why we have to be very well hydrated. There are medications in Parkinson's that lower the blood pressure as well, especially the dopamine agonists, right? And so be careful on that, because not only the condition itself, but also the medications can cause that problem. Hearing. I know it may sound trivial, but if we don't check the hearing, something so simple, the information may not come across like it should. So how can you remember if you're not even hearing what they're saying, right? Vitamins, and there I wrote a few things, because it's not only take vitamins, but check the levels, because sometimes it's not enough the Centrum and you need a little bit more. So your doctor should be checking your vitamins, your glucose. Uncontrolled glucose can cause memory problems. Uncontrolled thyroid can cause memory problems. And the same happens if you have an infection. One of the most common ones is UTI, or urinary tract infections, but it can also happen with COVID, with flu, with any other kind of infection, and medication side effects. Something so simple like drug-to-drug interactions, right? Sometimes we're taking medications that are for not even Parkinson's, for other conditions as well, that if you see the side effects, it actually can cause cognitive problems. So bring your list of medications to the doctor so you can kind of go over that and see what are the medications that may be causing problems in terms of cognition or memory. Sleep. Sleep is very important, and now I'm going to sound like a broken record because Dr. Okum said it already, but very briefly, Parkinson's affects the sleep. It can cause vivid dreams. It can cause punching and kicking during the sleep. You don't rest well. Your wife doesn't rest well either. But it affecting the sleep actually affect the memory. A tired brain is not a good brain. So not only Parkinson's, but at this age, most of us here will have some kind of urinary problem due to prostate problem, or because we already have too many kids for the females, right? So we go many times to the bathroom during the night. And that is another problem that needs to be addressed. Sometimes not only with the neurologist or with a sleep doctor, but we get the urologist involved as well. Social activity is super important. During COVID, we got a lot of consults from memory problems, and it's because people were not talking to each other, or if they were, was on the phone, and that's not good enough. That doesn't count. So like social interaction face-to-face. There are studies actually that were trying to track patients that were doing the social interaction via FaceTime versus face-to-face, and the difference was significant. Even FaceTime was not enough. So sometimes we don't feel like going. Sometimes there's not desire. I don't feel well. This is part of the treatment. You have to stand up, you have to get up, and you have to go. Either you go to your church, or you go to the coffee shop, or you go with your friends for lunch. Just do it. Just have to push yourself. There's nothing that will replace that. And as I said a little while ago, the medications are not going to work well if you're not doing those activities that we just mentioned. Now, there's a lot of technology that are coming out now that are going to be available for all of us. They're actually available already. Some of them are more user-friendly than others. I tried myself, and for some of them, I'm like, okay, I don't even understand because they can get very complicated. You have to look for the one that actually works the best for you. But I would encourage you to start looking for this, because this is the future, right? We can still write things down on a paper, and that's fine. Make sure that you don't write it on the envelope and you throw away the envelope, right? So very organized, as I said at the beginning, because that's the problem with Parkinson's. And when I say organize, I don't mean like organize the room. I'm talking about inside your brain, right? But now these devices are out there, and as I said, these are the future, and we all need to kind of get familiarized with them. You may need your family members to explain them at the beginning, but it's a good way to remain independent. And I was telling you at the beginning that the key word here is independence, right? We want to stay home the longest possible. So we are going to need things like this. There are medication trackers that you can get in your iPhones, but there are alarms and reminders, and there's a lot of different alarms, not only on the phone. You can get them in Alexa, Echo, Siri, whatever name they put it, but alarms and reminders. And one that is very important is that if you're actually going to set an alarm, go and do it before you turn it off. Because the majority, including myself, I turn it off and then I forget, that I had to do it. Put names and labels. Why is that alarm actually going off? Is that alarm going off because I have to go and take my levodopa? Or is that alarm going off because I have to go to the kitchen and take the chicken from the oven? So, because you're not going to remember. It's a common thing. Why is that going off? What do I have to do, right? So label things as well is going to help you. Meditation, and I write meditation apps, but meditation doesn't work for everyone unless you know how to do it. For us, it's very nice as physicians to say you have to meditate, but majority of people don't even know what is meditation or don't know how to do it. So actually, it could be praying, it could be something else. It doesn't have to be meditation, but something actually that will calm you down. And what we're trying to do with that is managing the stress, right? So whatever it is, thinking that you're at the beach, thinking that whatever calms you down is what I mean with meditation. Here are 3 examples of different apps that are available in your iPhones. So I check all of there are more than those. I just put these 3. Some of them, as I said, are more complicated than others, but they go over like a few things that you can keep track over there and then share those with your doctor. What we're trying to do is also monitor not only your shakiness or your slowness of movements and falls, but also the other symptoms that I mentioned that were below in that iceberg that I showed at the beginning. And cognition is actually one of the things that you can keep track as well. Then there's support and resources. Obviously, there's the local one that they're here with us, and the Parkinson's Association of Central Florida, that they're doing a wonderful job. And I would recommend everybody to be actually, be participating of this association. They have a lot of helpful resources. Now they have the walk that Todd was telling us a little while ago. So that's on April 6th. And this is not only to raise awareness, but also to, raise money so we can actually have, we can do more research, etc. So join them. It's a very good association. They have, I think, online as well, so it's not only face-to-face, but online resources as well if you cannot make it to their meetings. There are national organizations as well that I can share with you later if you want. Research is very important. That's the future. When you have a chronic condition that has no cure, you just want to be part of the solution for this, right? So if you don't participate in research, there's no way that we can advance in the treatment, right? And there's different research that they're looking for not only healthy subjects, so the spouses can actually participate, but patients in all kinds of stages. Some of them involve drugs, other ones do not involve drugs. So they're looking for so many different things. But the importance of research is we have to talk about this. And in my particular niche, I have to talk to the Hispanics. Unfortunately, we are culturally the lowest one that participate in research. And this is not only in Parkinson's, but in Alzheimer's as well, and other conditions. But those 2 in particular, I can tell you that has been a problem, right? A lot has to do with the misconception that at some point, there were some regulations many years ago that were not the best. And obviously, there is this misconception, and they will come to the clinic saying, I'm not going to be a guinea pig. We're not talking about guinea pigs here. And I would understand why you're saying that. However, give it a chance and listen to the regulations. This is very well regulated right now, and we really need participants. We actually are doing a Neurology One research for both for Alzheimer's and Parkinson's, but at a state level and the national level, there's many research going on. Obviously, the different foundations, et cetera, that I can share those with you if you want at the end of the day. Just to recap, again, we do have memory problems as we grow older. Parkinson's are gonna have similar problems that the regular population or the normal population, just a little bit faster in terms of, it takes them, if you compare somebody with Parkinson's with somebody that does not have Parkinson's, the difference would be just that one is a little bit worse compared to the other, but it's different from Alzheimer's, okay? Now, the problem, as I said, is a disorganized brain. You know that you have that information, but you just don't know where you store the information. So it's that retrieval of the information, the problem. And we can do things, as I told you, about writing things down, planning ahead of time, the pill trackers, the alarms, etc., just to try to remain as independent as possible. We spoke about the brain health and what to do, right? That we should all be doing it here in the room. And then, obviously, trying to make sure that, that the stress and the anxiety and then depression and these other conditions that can worsen the memory are being taken care of so we can have a better outcome. And I think with that, I finished my presentation for now. We're going to have a question and answer at the end of the day. If you guys have questions, I'm sure there's going to be a lot of questions may come about dementia and Lewy body and all these things. I didn't have time to cover it here. I just made it as brief as I could and as helpful for everyone in the room, not only for Parkinson's, but I'll be happy to answer questions later. And thank you.